Hello, I'm Dr. Randy Mitchmore with LifeSmiles University on location at one of our actual events. You're an experienced dentist, but you're searching for something more. That's why you've expressed an interest in what we do. We like to work with dentists that have a passion for dentistry and a passion to be even better, and perhaps financially better. We have a two-pronged program. The first is called the Ultimate New Patient Experience. That's where we teach you and your team how to create the buying environment and the actual experience a new patient can go through to help lead that into the next step we call the planning appointment, which is actually a sales training technique. You see, I find so many dentists have invested so much time and energy in continuing education. They become CE junkies, and they've taken every course imaginable, and they're just not seeing the results, or they get frustrated that you know so much dentistry, but you're not able to use all that you know. I'm here to tap that potential and turn that into something that you feel good about. I would like to see your schedule filled, not with busyness, but with productive dentistry that you enjoy doing, and that your patients receive a great gift of your talents, and your team is handsomely rewarded as well. We are an actual practicing dentist. We will let you see behind the curtain and actually come to LifeSmiles Global Headquarters in Houston and see exactly how we do the magic we do in the relatively small space that we do it in. I promise you will be blown away with the amount of dentistry we do in a relatively small number of chairs and space, but in an elegant and professional way. Come feel the excitement in creating the ultimate new patient experience, how to provide the most thorough dental physical a patient has ever had, and then go into the planning appointment, how we design that as a business agenda with a goal in mind, and we will take you from good to great and create an excitement and passion in dentistry that you've always dreamed of having. Welcome to LifeSmiles University. As an example of some of the things you will experience, we will go over how important it is to listen to your patients and remember to write down their exact words.
These are the exact words. These are also in your notebook. A mouth doesn't fit the picture of such a well-groomed guy, Dr. Mitch Morris says, and he goes, I certainly have sadness. He said, I need a hug.
Because those exact words of that patient is going to come in to benefit you in learning how to listen and communicate with your patient, how to develop appropriate treatment plans that revolve about what a patient wants and get beyond needs-based dentistry. You'll receive personal private coaching, both yourself and your team, how to use diagnostic photographs of diagnostic quality, how to build excitement with your team, how to give handoffs from one team member to another, the agenda that is so important to run a business-like planning appointment, otherwise known as a treatment conference. We will open your eyes and maybe take the ceiling off of yourself and your team of what is possible. Frankly, one of the things we'll do is challenge you to get out of your comfort level. You see, all buying decisions are made emotionally and then based on logic, and most dentists are logic thinkers. So I will challenge you how to get on an emotional level. The emotional one is, I really want a nicer smile. That's what I really want. Logic, fix cavities, do things that way. So Janie will give them permission, they can have both. Like, we have to be careful not to put our values and judgments too heavily on the patient. I'm there to guide, I'm not there to make their life decisions. When you are here, you will be challenged to take that self-imposed ceiling off of yourself to actually see bigger cases. I find you only see what you know. So we will actually look at clinical cases that I have done or cases you may want to bring yourself. And we will teach you and your team how to see dentistry that maybe you're overlooking. You see, it's not the patients that you're having come to your office that's the problem. It's getting everyone on your team to recognize the potential and possibilities that are already there. How to recognize your A patients, B patients, and C patients, and the patients that just are not the right fit for you in your office. We'll teach you how to recognize that early and make life so much better for both you and your patients. Your A are your awesome patients. Your B are your basically sound patients, your bread and butter patients. The C are the ones that are complainers, changers, and the D's are the ones that are just actually atomic bombs when they walk in the office. The personalized coaching and teaching will let you practice in a safe environment new styles and new ways of communication. You'll learn how to overcome the 10 most common objections that you'll hear from your patients and be ready to provide those answers in a professional manner.
I'm going through the objection on that of I need to think about it and talk to my husband at home. If you will notice, I'm hitting the objections. Money, time, think about it, all those things. We're hitting all the objections here.
An interesting feedback that I get from so many of the dentists that come here is for the first time they're seeing their patients as real people, not just teeth that need to be fixed. We will teach you how to get comfortable and how to develop a relationship with your patients, where it becomes talking with them is much like talking to a good friend over your kitchen table, not some fancy closing sales technique where you need all the one-liners. You will see the difference here and feel the honest, genuine level that we teach people in a cost-effective and ethical manner. Planning appointment, we've got that triangle going on. It's the doctor, the patient, and Janie. And Janie will actually scoot over closer to the patient. And her role truly is as the patient advocate, because as I mentioned earlier, the patient really doesn't know the right questions to ask. So Janie is so brilliant, she will ask me questions as the doctor as if she were the patient. You'll see the bobblehead on the patient. It says, yeah, that's exactly what I wanted to know. Just didn't think to ask it or know how to ask it. We expect so much out of our hygiene department, and we expect the hygienist to be talking with our patients and recognizing dentistry that may be beneficial to that patient in the long run. And what I find, the hygienists simply have not had the training in how to recognize dentistry. They might be excellent and professionals at cleaning teeth, but you will be amazed how hungry they are to learn dentistry. That's your hidden gem in the hygiene department, but they have to have the training. Make certain your hygienist is here. That's such a vital part of the team. And we will give personal coaching, and they will get to practice in real time, recognizing dentistry and actual case studies that we'll look at. Don't leave anyone out. You'll regret it if you do.